Okay. I'm checking in a new patient before I take the route slip back to the assistant. We need to make sure that all insurance is already verified and into their smart docs. We need to hand them the new patient forms, have them fill out three pages, consent and HIPAA that needs to be in their account, in their smart doc before it goes back. That's right. I have a new patient over.
Okay, so as clinicians, we can inspect the routing sheets. In this instance here, if I'm in the clinic and I see that there's 3 routing sheets that are up here, I know that my patients are stacking up in the waiting room. So I can come and evaluate these routing sheets and figure out which one might be more important. Okay, so let's say that this is an emergency that's number 2, and that it's going to be something that's very quick. So I can just simply reorganize that, put that up to the front, and then the assistants will know that they need to be picking out the first one here. Okay.
All right, so I'm going to pick up this route sheet. I'm going to take a look at the appointment type. This appointment type is going to be a new patient. So we're going to come over into here and we're going to grab the basic tray because the basic tray is what we get from new patients. And then we're going to take it to the room. So when it comes to a new patient, we're going to put the form over here. We're going to grab a pen, our business card. We are also going to come over here, pull up the chart. We set up our tray and then we go grab our patient. All right, so I am going to take my route sheet up so I can make sure I get the correct patient. Jane. Hi, I'm Allison. I'll be your dental assistant today. I'll just take you right back to the room. Okay, so then after we seat the new patient, we come in and we triage the patient so that we can tell the doctor everything that they need to know. So what's going on today, Jane? Are you having pain on your lower left? Okay, perfect. I'll go grab the doctor. But before we grab the doctor, we want to make sure we have the route sheet, the business card, the pen, and when we have the chart, we want to make sure our chart matches our route sheet. Dr. Scott, I have patient Jane ready in 5 here for a new patient emergency, having pain on an 18.
All right. Thank you. Okay, so we're going to go over the new patient limited exam, one of the most common procedures that you're going to see. It's super important to understand the flow of what's going on and be super consistent on how you word things, concentrating on your intonation of words, your words that you're actually using, so that you can get it right. It'll become super second nature to you. You don't want to sound like a robot, but you do need to include all of the steps of the new patient limited exam. Thanks for coming in on Dr. Stotts. Nice to meet you. Nice to meet you. Where do you live?
Here, Meg.
Awesome. Cool. How did you hear about us?
My mother comes here.
Awesome. Okay. So with the new patient limited exam, if you look at it, there's a bunch of scenarios on how the new patient is going to introduce themselves or how they heard about us. Okay. So for example, in this instance, how did you hear about us? And she said, my mother comes here. So in that instance, what you're going to say to the patient is, oh, awesome. How are we treating her? Meaning, we're going to treat you amazingly. Why? Because there would be no way that you're in here if we're not treating your mother amazingly. So we're kind of setting the stage that we're going to be treating this patient amazingly. Okay. The second scenario is she could have said that she heard about us because she saw the sign on the outside. Awesome. Okay. The sign says open and affordable dental. So I'm simply going to say, oh, awesome. You probably heard that we're here from 7:30 to 7:30, Monday through Saturday. So whenever you need us, we're here for you. Okay. So that's kind of the standard spiel. And it's very important to enunciate and also concentrate on the fact that we're here till 7:30 at night and we're also here till Saturday. Okay. The third option here could be they heard about us through their insurance company. So they're most likely a blue collar worker, and they occasionally switch jobs. Okay, and it's important for them to realize that we are in network for almost all insurance companies. So if you look at the verbiage on our signage, that's what it says, almost all insurance companies. So make sure that you say that, okay? So we're in network for almost all insurance companies. So if you ever change insurance companies, we'll still be in network for you. So we just eliminate the stress that if we change insurance companies, they don't have to find another dentist, okay? And then after that, we go into the normal portion, which is you might have heard we're here from 7:30 to 7:30, Monday through Saturday. So whenever you need us, we're here for you. Okay. Okay. The fourth option is I was going to another dentist. Okay. This is a perfect opportunity for you to get as much information from the patient as possible as to what the other dentist was doing that we could do better. So I would say, oh, okay. So what was your other dentist doing that we could do better? And then they're going to tell you a bunch of stuff that you are going to make sure that you don't repeat. Now, a lot of open and affordables flow and systems have been designed around our learning from what other dentist offices are doing or other poor patient experiences and a lot of their feedback. So we have systems designed around avoiding all of those things. But this is the perfect time to get all of that information. Okay, so then we'll go into the standard dialogue, which is so we're here from 7:30 to 7:30, Monday through Saturday. So whenever you need us, we're here for you. I'm going to get you my cell phone number. So, and now the cell phone number that we're going to use is the after hours phone number right off of our website. Okay. So you can take a look at that. In this case, it's 720-580-1117. Okay. So I'm going to get you my cell phone number. If you ever have a question night or day, don't hesitate to give me a call. And then if you do have a good experience with us, I would love to see your friends and family. I'll give them all free exam and x-rays if they want to come in. Okay. So the intonation of your words is super important. Okay. There's a difference between if you have a good experience, send in your friends and family versus if you have a good experience, I would love to see your friends and family. I'll give them all free exam and x-rays if they want to come in. The idea behind that is when open and affordable started, we had no patients at all. And, I would see 4 patients in an entire day. And I was literally begging patients to send in their friends and family so that I could be busier. Okay. So you need to have that drive and those connotation and words to make the patient understand that, first of all, we are taking new patients. Some patients don't think that we're taking new patients. Yes, we're absolutely taking new patients. And we're just building it into our dialogue to ask for patient referrals. Okay. One portion on one of the other options here is the patient might have said that they saw us, they Googled us or found us on the internet. If that's the case, we want to go into the 7:30 to 7:30, but we also might want to ask, hey, did you happen to see our 5-star reviews? Meaning we're kind of setting the stage for this patient to give us a 5-star review at the end of the appointment. Okay. Another concept here is sometimes I see doctors that have pre-written all of their phone numbers on business cards. And then when they come in here, they essentially just give the patient the card that has already been written on. And I always say this, okay, if you are a female, okay, and you are at a bar and a gentleman walks up to you and he pulls one out of 50 business cards out of his pocket that already has his phone number written, versus another gentleman who comes up and writes his phone number down and gives it to you, what is the chance that you're going to call the first gentleman versus the second gentleman? So be aware of that. You need to be writing this down right in front of the patient because they're going to feel special. Okay. So I'll go ahead and write down their phone number. And I'll write down free exam plus X-ray, okay? And then I will give it to the patient, okay? So at this point is when we're going to ask the patient, so what's going on?
Toothache on the bottom right.
Okay. So really, it doesn't matter a whole lot on what the patient says, because we are going to always order a panoramic X-ray. Okay. So what we're going to do is we're going to break into the second part of the new patient limited exam, which is this. Okay, and I'll say the words and then I'll explain why I'm saying those words. Okay. So what I'd like to do is we're going to grab an X-ray that goes all the way around your head. Okay. So why are we taking a panoramic X-ray instead of a bite wing or a PA? First of all, legal concerns. We need to be able to see their entire dentition. Okay. Would you ever like a dentist that if you brought your mother in and she had a chip on number 9, they didn't take an X-ray, and then 2 weeks later she had an abscess on number 15 that they didn't get? Okay. The other thing too is I can't count the number of times that I always wish, for insurance purposes, that I had a picture of the patient's entire dentition before I ever touched them. Okay. I've had other instances where there was a foreign object underneath their gums that I saw on the pano. They got referred out. Another doctor made them aware of it. And if I hadn't had that pano, they could have accused me of having that foreign object in there or causing that foreign object to be in their mouth. So we always take the panoramic X-ray, okay? And when I signal down the hallway to my assistants, if they're not around, I'll just go ahead and do this, which is the international sign for panoramic X-ray, okay? So what I'm going to say to the patient is, so we're going to take an X-ray, goes all the way around your head, and then we'll take a look under the covers to figure out what's going on. So what I'm saying is that me and the patient are going to look together to figure out what's going on. This isn't going to be a situation where the doctor is dictating what we're going to do. No, we're coming up with a game plan together, okay? Then what we'll do is we'll come up with our game plan together as far as what we both want to do, okay? So again, we're coming up with our game plan with the patient. I'm not telling the patient what we're going to do. The patient and I are going to decide together what we want to do. It's essentially like we're giving the patient a menu. Are we going to do the root canal? Are we going to do an extraction? As if we're in a restaurant. Are we going to order the steak or are we going to order the salad? It doesn't matter to me, but we're going to both decide. Now, if the patient wants to do a filling, but really we need a root canal, that's why we both have to decide together, because what the patient wants and what is clinically possible might not coincide. So we're going to come up with a game plan together, okay? So the fourth item is we're going to go over prices of that game plan. We're not going to be doing a $1,200 procedure and then the patient is surprised up at the front how much this procedure costs. The patient is going to know what we're doing and the price. And in fact, when we go over our options, if we're going to do a root canal or a fill or an extraction, the patient is going to make the decision with the doctor. Hey, I can't afford $600 for a root canal, and I won't be able to afford the $400 for the crown. So we're just going to have to do the $200 extraction. So it's very important that they know prices and that prices are built into the treatment plan. Okay, and then finally, the fifth item is we're going to say we're going to get you all fixed up. Why is that important? Because we've learned from patients that they go to a dentist office, the dentist office takes 1,000 x-rays, they come up with this $20,000 treatment plan, and then they never get anything done. And then they're rescheduled for the next couple of weeks. Does the patient really want to come back for $20,000 when they really only had a chip on number 9? So it's very important that we address the chief complaint, okay? We want to make this appointment as short as possible. We want to get them out of the office as quickly as possible with their chief complaint addressed, okay? Think about all of their previous dental experiences where they were told they need all of this work and they got rescheduled and they had to sit in the office for 4 hours. In our instance, we're telling them what the prices are, we're addressing just their chief complaint, and then we are getting them scheduled back for hygiene. Okay. In fact, if patients want to have kind of like a comprehensive oral, they're like, hey, do you think you can look at some other teeth? I usually say, let's go ahead and get this one tooth fixed. We'll get you back with our hygienist, and then we'll do a full exam. We'll take some additional x-rays, and we'll get every single tooth looked at that point. Again, that also makes us, a little bit of money in that we're breaking up the panel from the bite wings. And so our insurance company isn't going to downcode that to an FMX. So let's just review what we're going to say after we are talking about our office. Okay. So what's going on? They explain to us. And then what I'll say is, so let's go ahead and take an x-ray. It goes all the way around your head. Okay. Number one, we'll take a look under the covers to figure out what's going on together. We'll come up with a game plan together as far as what we both want to do. We'll go over prices of that game plan, and then we'll get you all fixed up. Okay. So not memorize, but have it very ingrained in your head, this entire new patient flow, so that you can come in and make it sound completely natural. So at the end of this dialogue, I'm going to just tell the assistant, go ahead and get the pano. And then what I like to do is just a pat on the back of the patient's shoulder, which to me is an expression of empathy and kind of an emotional connection with the patient that says, hey, I'm here for you. I will take care of you. Let's get this figured out, and let's do it in a comfortable manner. So.
Okay, so after you take your pano, you're gonna take your patient back to the room. We're gonna sit them in their chair. We bib them. We pull up the pano. And after we pull up the pano, then we go grab the doctor and we let them know that the pano is ready.
Okay, so as soon as the pano is out, obviously we're going to come in and diagnose what's going on. Okay. And, obviously there's a couple of scenarios what happens here, but usually what you're going to do is you're going to go over prices with the patient, figure out what you're going to do. And then your next step is to anesthetize the patient. Okay. You want to get that going right away. Now, when you anesthetize the patient, obviously the first thing that you're going to always want to do before you put any type of drug inside of a patient is ask them what their medical history is. Okay. You need a verbal confirmation that they aren't pregnant, they don't have any heart conditions, and they aren't on any blood thinners, depending on what procedure you're going to do. If you're going to be doing a little occlusal, it's not the biggest deal in the world if they're on blood thinners. But obviously you want to have that in your brain so that in the future you kind of know what's going on. And you're going to verify that with what is going on in EagleSoft. Okay. So you'll anesthetize the patient. Okay. You're going to use progressive anesthetic technique to control how quickly you're going to come in here and do the procedure. So if I have no one else in the office, I might give her a half a carpool of anesthetic. Okay. If I have 7 other patients in the office, okay, I might give her 2 drops of anesthetic under the mucosa, so that it gives me time. And when I come back into her, she doesn't feel like she's completely numb, AKA it gives me more time for more breakout points. Okay. So I'm going to anesthetize the patient. And then one of the most important things that you do in dentistry, which is, I call this administration. Okay. So you're going to go to EagleSoft. You're going to walk out the procedure. You're going to make sure that everything looks perfect as far as the insurance, as far as their benefits. You're going to make sure that you use exploding codes to make sure that every procedure that can be walked out is walked out. You're also going to check in SmartDoc. And, like one doctor said, you need to live in SmartDoc. You need to understand, does what's in EagleSoft coincide with what's in SmartDoc? Okay. EagleSoft is only as good as what your front office has put in there. And so you can't really trust everyone blindly. So go into SmartDoc and make sure that that coincides with EagleSoft. Okay. You need to make sure that your lab slip is done. Okay. So you need to get all of this administration done before you pick up an instrument. Again, no picking up an instrument until all admin is done. Okay. Your overriding question at this point is, how am I going to get paid for what I'm doing today? Okay. If you think that you just putting in an ADA code and walking it out means getting paid, you're absolutely wrong. Okay. There's about a 99.9% chance that you are not going to get paid unless you do everything 100% accurately. So again, admin, 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 and do not touch an instrument until that admin is completed. Okay. You want to also get it to the point where as soon as this procedure is done, you can walk out of here and deliver the routing sheet to the front, and the patient can just go right out to the front, pay, and get out of here. Do you want to be asking the patient to get their next appointment scheduled after you've done the extraction? No. This is the point right now that your assistant should be scheduling their next new patient to hygiene appointment. Okay. And then you need to come in and verify with the patient that the assistant has done it. Again, just like you live in SmartDoc, you're going to verify everything that the assistant is doing to make sure that everything is perfect, because you don't want this patient scooting out of here and they never come back simply because you didn't have their next appointment scheduled. Okay. So again, very, very important that you do this. Okay. Every step is super important. Okay. So the doctor's going to complete the procedure, and then the doctor's going to go over the post-operative instructions. Okay. Potentially give them the gauze or whatever needs to be done on the post-operative side. And then the doctor is the person who takes the routing sheet, the consent forms, and whatnot up to the front. Why is it that the doctor is doing that? Okay. A couple of different reasons. Okay. If there was a patient balance that is different than what shows in EagleSoft, we're going to write it at the very bottom of the routing sheet. So for example, let's say that we did a $500 procedure today and the patient was only able to pay $300. We don't want to get into an uncomfortable situation up there, saying that the patient comes up there and we don't know the balance. Okay. The other thing too is it's really important to create a logical breakaway from the patient. Okay. It's a little bit rude to just walk out of here without finishing the conversation. Okay. So my normal dialogue is, okay, sounds good. I'll take this information up to the front and you can just go up there and check out. Okay. The other reason back here in the clinic that the provider walks up the routing sheet is, imagine you have your assistant and a patient here. The patient tends to want to carry on the conversation, whereas the assistant wants to flip the room. So for the assistant, it's a natural break in the conversation to say, hey, the doctor brought up the routing sheet up to the front, so you're good to go up there and get all checked out. Okay. So again, the use of the routing sheet is important for all of these types of things in the clinic. Okay. So I deliver the routing sheet and all of the consent forms to the front. Okay. Again, it's super important as far as the patient experience to have the provider give the routing sheet to the front. Imagine if the patient came up here without the routing sheet. The first question that the front is going to ask of the patient is, what is your name? Okay. Again, the patient experience is not as good versus, oh, okay, Frank, sounds good. Here's your balance. Okay. We already talked about the patient balance being written on the routing sheet versus being pulled up from EagleSoft. Now, in normal cases, I can say either the patient is good to go, meaning they can walk right out of here and there's no problem. Okay. So your collections are going to be higher if there is a balance, because if there is a balance, I'm going to say, okay, Michelle, she knows that she owes some money. Okay. What does that mean? Michelle's going to look at the patient balance on EagleSoft and simply collect what is in EagleSoft. The other thing could be is, hey, Michelle, she's going to only pay $300 today. And then it's written on the routing sheet because I might have just got done with a crown prep and the patient isn't going to find her way up to the front for another half an hour. And so there could be confusion on which patient this is. That's why it's written on the routing sheet what they owe. Okay. And then again, on the patient balance, okay, I always say this example. Say the patient is a younger male, okay, and he's been bragging to his girlfriend that he's this rich guy, okay, and he drives this awesome truck. Well, back in the clinic, you come up with a game plan that he can only afford $250 today. And then you come up here to the front and you haven't written the patient balance on the routing sheet. Then what's going to happen is he's going to come up to the front and Michelle's going to say, oh, so we're looking at $500 today. And his girlfriend is sitting right here next to him. And he has to have the uncomfortable conversation with Michelle that he had in the back, but the girlfriend wasn't back there. Oh, he only has $250 today. So again, all of those little points are super important in order for us to bring the patient all the way in and all the way out of the clinic, knowing where they're at, what order of priority they are, and understanding what's going on all the way through it. Everyone always knows what their name is. So that's the entire flow of a patient beginning to end. Now, Michelle's going to take the payment and then or set up a payment plan, whatever the doctor discusses with them. Again, the doctor is the one who has made the financial arrangements, not the assistant. So does the assistant bring up the routing sheet? She has no idea what's going on with the finances, and that's the purpose of having this. So we're not breaking any of the essentially chain of command here or losing what's going on with the patient. So super important to follow that flow.